All right, people, so we're back. And without further ado, we're going to go to Seth while the board is with us via Zoom. And boy, I've been waiting for this day, you know. Is it a good day when you know you were right all the time? Morning, Seth.
Morning, morning.
What's going on?
Thanks for having me on, and good morning to all our viewers.
Nice, man. Now, I have the response from the Ministry of Health in front of me, which I'm going to let you read. You go ahead and you read it out, because you did file a Freedom of Information Act request, and you asked 5 very important questions, right?
Yes.
So the floor is yours.
All right, so let me share my screen here, that we could all be on the same page. So
Lovely.
first, from the top. Now, I sent in 2 requests. One, I got a response last year, in April of last year, and that was from a request I sent in on the 14th of July, 2021. So it took about 10 months.
Yeah.
All right, but I asked if COVID-19 was isolated and purified. Their response said no, it wasn't. Now, some people have said, oh, you asked the question too vague, so that's where you'll get that response. So I decided to send in this one now, where I asked, which I sent in 26th of April of 2021, as you can see here, 2022, sorry. All right, and I got the response just on the
8th of May, 2023.
8th of May.
Yeah.
All right, 2023. So let me read the questions. It says, has SARS-CoV-2, the virus that causes COVID-19, coronavirus disease 2019 nCoV, been isolated and purified? Has SARS-CoV-2, the virus that causes COVID-19, coronavirus disease 2019 nCoV, been isolated and purified using Koch's postulates?
Now hold on, stick up in right here. Stick up in right here.
Yeah.
Just explain to the audience what is Koch's postulates.
Right, so that is the method, or one of the methods used for virus detection, right? If you have to detect, or any pathogen, actually, you have to first, extract a sample out of the host, separate that sample from all else, saying this is what you believe to be what causes the illness or the disease. You have to then take that sample and infect healthy cells. Then you have to take a sample from the healthy cells, them being infected, and extract from that sample the same virus that has been originally inputted into the sample to show that it replicated in that sample to cause disease. And then you compare those 2 samples and make sure they are identical.
Right.
Right? That's how you know that there's a existing pathogen. Right? You have the reverse postulate as well, which is very similar, almost the same thing.
Okay.
All right? So I asked those questions. They say, no, well, we will see
we'll get to that. Go down to 3 now. I just wanted to explain to people what that process is, because I'm going to make a point. Go ahead.
All right, so the 3rd question, provide documentation describing how the genetic sequencing of SARS-CoV-2, the virus that causes COVID-19, was established and used to calibrate the PCR test, polymerase chain reaction test.
Right.
4, provide documentation describing and or elucidating the significance of higher cycle thresholds versus lower cycle thresholds when conducting diagnostic testing using the PCR test for SARS-CoV-2. 5, describe and or demonstrate SARS-CoV-2 asymptomatic infection and transmission in the absence of clinical evidence suggesting disease, that is, symptoms of disease.
Okay.
Their response? In this regard, the information with request to the Freedom of Information application, the Ministry of Health is not in possession of the information requested.
Okay.
So in other words, our government does not have any information on even the existence of COVID-19. None. They have no information on even the testing method or the accuracy of the testing method via PCR tests on COVID-19. They literally have absolutely nothing on COVID-19. And they shut down
But
the entire country.
We got to call it, they have absolutely COVID-19, because COVID-19 and nothing is the same thing.
It's the same thing. It's the same thing. So they shut down people's businesses. They bullied and tortured, and I'm using that word, they bullied and tortured the citizens of this country. They took away your rights, your constitutional rights, your civil rights, all of your rights. They trampled upon it. They insult you. They segregated you from your own family, from your peers, from your co-workers, discriminated against you via vaccine status, and they have absolutely no evidence on the existence of this thing that they shut you down for. Now, keep in mind, because I like to share other stuff, right? Because I like people to not just say, oh, well, you know, maybe he could be a little off with what he's saying. A lot of people in this country are not aware of when it comes to data, right? Now, I want to show something here. This is how much people have died from 2020 to present from COVID. 4,390.
Well, supposedly.
Supposedly,
COVID,
right?
Yeah, go ahead.
Supposedly. In 2019, our total all-cause mortality.
Wait, Seth. Before you even go further, before you go to 2019, I want them to make sure they understand that out of 191,496 cases, 187,078 people recovered.
Recovered, correct.
And you had 4,390 deaths out of 191,496 cases. Because one of the things that I was saying when we started the question, we said, but why are you locking down the entire world based on a virus with a 1% mortality rate? Right?
And it's actually less than that.
And it's actually less than that, if you look at it globally. Right? But however, we had the highest deaths per million population. But nevertheless, let's go on.
Yeah, so 2019, we had 12,000 deaths in total, all-cause mortality from accidents, crime, communicable diseases, non-communicable diseases, right? But out of those 12,000 deaths, non-communicable diseases in 2019, this is long before COVID, right, was 66% of that 12,000 deaths, which is approximately 8,000. About 8,000,
yeah.
Deaths. So about 8,000 people died from non-communicable diseases in 2019 alone. So Stefan, I'm going to share my screen again and show something else, because remember, when I send in requests, I didn't just send in for this particular question alone. I also got from the government, I asked for their influenza data. So let's see influenza cases from 2018. We had 4,598 suspected cases of influenza. Now, this is suspected because, again, remember our previous Freedom of Information request, we don't have any sure way to test for influenza either.
Right? That's right. And
we had 7 deaths that year of suspected influenza cases. 2019, 3,854 cases of suspected influenza cases, right? And 44 deaths of suspected influenza deaths in 2019. But all of a sudden,
it drastically dropped.
In 2020, influenza just decided to go on vacation, right? So I guess they were short-staffed. So because they were short-staffed, we only had 854 cases of influenza in 2020. And then in 2021, some of the staff, I guess,
it almost disappeared.
They probably will follow. They will probably follow.
Like in 2021, there was working Petrotrin because it shut down. So it only had 115.
Shut down. So influenza just shut down to 115 cases. 115. What I am seeing is what we did. We simply started to reclassify cases and call everything COVID. Now, I ain't done yet, because I want to show something else.
Go ahead.
Right? I want to go back here, because I want us to see.
And I want people to understand, if the maths in, something wrong somewhere. Go ahead.
Right? I want us to see some more stuff. because this here is from the diagnostic panel, from the PCR testing, right?
Because that was the other thing that was in question, the accuracy of those tests. So go ahead.
Right. So this is from the CDC. Let me jump up so people will see what it is. Right? CDC 2019 Novel Coronavirus 2019 NCOV real-time RT PCR diagnostic panel for emergency use only. This is from the CDC. Right? So you jump down to page 44. We go back up to page 44 and let's see performance characteristic. So they said limit of detection. Limit of detection studies determine the lowest detectable concentration of 2019 NCOV at which approximately 95% of all true positive replicates test positive. The limit of detection was determined by limiting dilution studies using characterized samples. Here's the punchline coming just now. The analytical sensitivity of the RRT-PCR assays contained in the CDC's 2019 Novel Coronavirus 2019 NCOV real-time RT-PCR diagnostic panel were determined in limit of detection studies. This is the important line here. Since no quantified virus isolates of the 2019 NCOV were available for CDC use at the time the test was developed and the study conducted, assays assigned for detection of the 2019 NCOV RNA were tested with characterized stock of in vitro transcribed full-length RNA, which they have in bracket here. This is where they purchased the genetic material that they calibrated the PCR tests from,
which had nothing to do with which had nothing to do with the virus itself, because they never isolated it.
They never isolated the virus, so therefore the PCR test was created from a genetic sequence purchased from a gene bank. Had nothing to do
with the actual virus.
What it goes on to say, it says here, to mimic clinical specimens. So they purchased a genetic material from a gene bank to mimic the symptoms that people in the hospital were having. And that is what they calibrated the PCR test. Now for those that might say, that ain't songing right, let me pull up something from the Lancet. The Lancet, the third leading medical journal in the world, what does it say? The Lancet Respiratory Medicine, role of exosomes in false positive COVID-19 PCR tests. Let's read. It says, we explain why a very large fraction of PCR tests are registering false positive due to a lack of specificity in vivo caused by exosomes that are not present in the specifications from tests in vitro. We discussed the fallout effects caused in false positive tests, not least artificial post-original pandemic peaks. I want to jump down to what the actual paper says and jump to the findings here. It says, we find that the PCR testing data for the second and following waves of COVID-19 pandemic indicate that these waves are mainly artifacts of false positive results. We find that this interpretation provides a more consistent explanation of the known epidemiology of COVID-19 than the hitherto consensus notion of extremely contagious and rapidly mutating viruses.
Yeah.
Stefan, what I am showing is that the entire pandemic was fabricated. It was fabricated. Our government did something. If you've taken somebody to court,
it's all of them, you know. It's not just all of them.
All of them.
This was a global thing.
It's a global thing. If you are taking somebody to court, police can't go on and just arrest somebody just so and put them in jail. They have to get evidence. This is why when it had with the kidnapping with the Balkan guy who had 70-something matters pending before the court, but he out walking around, it was because they could not provide evidence to prove anything, so they cannot keep them locked up. But we lock up every citizen in this country
based on no evidence.
Scrap evidence.
Based on no evidence. Come back in. Let me talk to you face to face here before we wrap up here, before we run out of time. This is what we're trying to explain to people for the last 2 years. And you were thinking just like me, because that's exactly how I was going to put it across. If the police lock me up and take me before the court for a crime, whether it is robbery or murder, they must have evidence in their possession, whether it is fingerprint, camera footage, some sort of evidence, eyewitnesses. You must have evidence to convict me. Without evidence, I am going to walk out of the courtroom a free man, whether or not I committed the crime, because you have no evidence to hold me.
And they have to pay you compensation for the time that you spent in.
That's right. And the test that we're using, we kept telling people, the test is not accurate because they have not used the virus itself to calibrate the test, because they have not isolated the virus. So how could you use a genetic sequence, a computerized genetic sequence? You have a virus, you're saying all these people catch it all over the world, and you ain't take a sample from one of them?
And that's the thing, and the general public not privy to the information regarding, how viruses are isolated and the whole process, and we accept these testing blindly.
Yeah.
And this is where the problem, the misdirection, the misinformation come in, right?
Because fear is a hell of a thing.
Because, as you mentioned that, let me show you something else here, Stafford.
Right. Let me see how quick we can do this. We have 2 minutes. Yeah.
Right. So this here is a document from the CDC, because they were showing conditions with, that how much people died and whatnot with COVID. And what they're showing, they actually had to put in a new category of death. And I want to scroll down to show you it quickly via
a new category of death.
Yeah, because
anxiety.
Yeah, look at here.
Where is it?
Fear and anxiety.
Fear and anxiety.
So after obesity, fear and anxiety was killing the most
amount of people.
That was the second largest comorbidity.
Boy.
Right? What happens when you are scared to the point that you're getting anxiety? You hyperventilate, so you're going and get the so-called symptoms of a respiratory illness, and then you go to the hospital and they're going and tell you, oh, you have COVID, right? Oh, you have COVID
using a test
you're not breathing good. You ain't have enough oxygen, right?
Well,
and
Seth,
people don't know that.
Seth, we out of time, but my brother, thank you. I'm glad that you got the response, and you see the biggest problem now is that people will move on, because that's how it goes. They do this to you, and then they toss all the little things like carnival and everything, and you go and you free up yourself, and you're lineman again, and you're out, and you're just glad to have your freedom back, and everybody forget what they did over the 2-year period. But we will not forget. But I'll thank you this morning, man.
People know me for my memory. I not forget
it. We will talk again next week, my brother. Out of time.
All right, thanks for having me.
Yeah, man. No problem. See? No birthdays, director? All right, so I just got to wrap up. But in wrapping up, I want to let you know, of every television show, of every talk show, of every host in Trinidad and Tobago that sat here during that 2-year period, I am the only one. And I tell management that, I say I go put my career on this, I know I'm going to take a big chance, But based on everything that I'm reading and everything that I'm seeing, this thing I'm going to challenge it. So I want to thank management for giving me the opportunity to be me, speaking my mind and trying to stand up for the truth. And for those of you who follow this program and you have followed it religiously, and for those of you who followed us during the coverage of the pandemic, there is no denying that it have no misinformation that you got here. Although we were taken down, we were blocked, we were abused by social media networks because we were challenging it. But we were here, giving it the whole truth and nothing but the truth. So help us God. And with that, we wish you a fine day until tomorrow.
Good morning. Welcome.